This is our presentation on contemporary issues in Australian sport.
We have chosen to do our presentation on concussions in the AFL.
Firstly, we will introduce ourselves. I'm Emma, and I'm an exchange student from Toronto, Canada.
I'm Mike, and I'm an exchange student from Miami.
And I'm Sarah, an exchange student from Collingwood, Ontario.
We'll first discuss what concussion is. A concussion is defined as a brain injury that occurs when there is stress on the brain, normally due to a collision or excessive shaking of the head. The brain is a very delicate but important organ in our bodies, and as such, our bodies developed a way to protect it. The brain and spinal cord is floating within our skulls in cerebrospinal fluid. This fluid protects our brain, and without it, we would be getting concussions just from sitting up in bed. However, when there is a collision with enough force, the brain can move dramatically enough in the skull, and the cerebrospinal fluid is not enough to protect it. What results is damage to the brain tissue or a bruise on the brain. Or what also can occur is a brain bleed. This injury causes a temporary lapse in brain function that results in the signs and symptoms of a concussion.
Some of these signs and symptoms include fatigue, headaches or migraines, memory issues, vomiting, nausea, and feeling unwell, dizziness, confusion, slurred speech, and problems with vision, including double vision and blurred vision. Like Mike stated before, sometimes concussions can result in a brain bleed. While normally medical intervention is not needed for a concussion, if there is a brain bleed, this can be fatal to the patient and they may need to seek medical treatment. This is why it is important to monitor the patient for at least 24 hours after the concussion to make sure their symptoms are not getting worse. This, along with vomiting that can occur, is why it is important to wake the person and monitor them throughout the night if a concussion is suspected. The seriousness of concussions and possibility of brain damage is why it is so important to examine brain injury in sport.
Concussion is a common occurrence in the AFL. During tackles and collisions between players are subject to head trauma due to lack of protective equipment. It is important that concussions are managed appropriately within the AFL to prevent long-term problems. In this video, symptoms of concussion are apparent as Dylan Robertson is experiencing confusion during his halftime video interview. The collision is shown at the end of the video. Focus on Robertson's head and the collision that had occurred during play.
They got a fair run at the start, so we just focused on trying to settle it down. You copped the big one from Tommy Jonas. Are you all right? Yeah. I don't think Dylan's head's right at the moment, so I might just let him go. So thanks for that, mate.
Let's have a look at it. This is the knock, and head clash. So big hit. Have a look at the headband come off here and that, and there it goes.
Some potential complications that may arise from concussion includes prolonged symptoms for up to 2 weeks, depression and psychological problems, as well as long-term brain damage. Typically, complications are seldom explained by concussion patients. However, AFL players that return to play before full recovery may be at risk to one or more of the complications discussed. There is also a rare syndrome called second impact syndrome that can occur in athletes if they are subject to a second concussion when the symptoms from their first concussions have not fully subsided. This can result in rapid and usually fatal brain swelling. This is why it is extremely important for coaches and team medical staff to recognize and treat player concussions appropriately to ensure long-term health of all players. The link between suicide and concussions has been in the news recently, and there is a correlation between athletes in contact sports who have suffered concussions and suicide.
The rate of concussions in the AFL have reached an ultimate high as the average number of games missed by AFL players due to concussion increased from 2.6 from 2014 to 2015. This statistic could be associated to the continuous rise in commercialization in Australian sports. In order to maintain television ratings and game attendance rates, sport executives need to keep up a lively, entertaining game. One strategy is to increase physicality of AFL matches. More tackles and collisions within the sport will ultimately lead to higher injury rates within the AFL. Another possible reason for the increase is that the possibility of long-term consequences of repeated concussions is more public, and people are encouraging athletes to miss games rather than endangering themselves further by playing with a concussion. Most likely it is a mix between these two factors. In order to try to reduce these negative effects of concussions, the AFL has created a guideline of a handbook.
The handbook was developed by the AFL Medical Officers Association. The guidelines outlined in the handbook should be followed by trainers, first aid providers, coaches, umpires, club officials, and parents. Once a collision has occurred, a medical officer with experience in concussive injuries should examine the player and make the decision whether they are able to return to play based on apparent symptoms. Coaches must comply with medical officers' statements and follow rules of the AFL Coaches Code of Conduct, so players' welfare and health are in full consideration. If a medical professional detects any symptoms of concussion, the player must not return to play or practice until a formal medical clearance has been completed.
The AFL has a concussion rehabilitation program which follows a stepwise system. A concussed player must first physically and mentally rest until all symptoms are cleared. Light aerobic activity, including walking and swimming, can then be introduced. Then, light non-contact training can begin, including running and ball work. Non-contact training drills may then proceed with light resistance training and more complex drills. Finally, full contact training after full medical clearance may begin, followed by return to play.
Although players, coaches, and medical staff realize the severity of concussions, many players are still being allowed onto the field without being fully tested for a concussion. This leads to decreased welfare of the players in their future after their career in the AFL. This may be because of the commercialization of sport, as I mentioned previously.
One of the biggest difficulties with this controversy is the commonality of asymptomatic concussion in the sport. Although a player may not exhibit symptoms after collision, they may still be affected by concussion, with symptoms becoming apparent later after the traumatic event. This is what makes concussion such a complex issue, as it is hard to fully diagnose.
The current concussion rate is 5 to 6 concussions per 1,000 player hours. This is equal to 6 to 7 incidents per season for each AFL team. In order to decrease the incidence of concussion, AFL players, coaches, and medical staff must continue to follow the guidelines set by the AFL Medical Officers Association and become more attentive to players' welfare. It is important to educate everyone involved with the AFL about the severity of concussions. It is also important to stop the stigma of sitting out a game. In the culture of sport, players are told to man up, to finish the game, and support their team. So many times that feeling like they shouldn't sit out even if they do not feel great. By destroying this stigma, hopefully more players can realize they are unwell and feel okay to force on getting better.